Hey, so let me try to explain maybe, possibly, potentially why I think manual therapy does something, because it clearly does. Any suggestion that manual therapy is useless or doesn't do anything is really unfortunate, and it's probably based in far more social circumstances or how an individual has perceived some of the competitive messages to what they want to do, not what they believe. That's my opinion. Because regardless of what is the proposed or purported change to the system, the fact is that we've all seen manual therapy at times appear to be magic, and especially when it's live. Obviously, anything you see on film could be edited like David Copperfield. But the reality is it's probably not happening for the reasons that we think are tissue related. There is mechanotransduction, in my opinion. I'll kind of try to position that, but I don't know that you're changing the actual histology or what the tissue is made out of. I think it's far more of a brain response. It's far more of a sensory response, and we can start there. Now, I think touch, if we just say touch, we should be able to put that into a very similar category as sight or smell or what we hear, okay? Now, there's a very, very keen neurological process that if you touch someone, that certain nerves, specialized nerve endings, are sending a signal, and those signals are going to the brain, and then we're referencing those things in a form of meaning. And if that meaning is inherently positive, there's probably another cascade of things that happen that are probably more autonomic than anything else. That's just from blanket touch, even getting touched by a blanket. So any type of manual therapy, there's something that's happening there. And I think you can also never dissociate yourself from the realities of oxytocin, which is something that typically makes someone feel good, serotonin, and dopamine. All three have feel-good effects. All three can very much be related to the actual touching of the system, as well as the anticipation of touch having a positive effect. So we've gone very, very far away from even collagen or what we think manual therapy is doing, and are you genuinely moving a joint from here to there? You're doing something. And I think the challenge to manual therapy is very often that there's no even real reason to believe that there's truly a purely mechanical impact, that you're breaking an adhesion or somehow moving a joint to a more desirable place. I think that can happen. I mean, if your shoulder is dislocated and it's hanging out in front of the glenoid, and then you put it back based on this manipulative technique, and then it lives a little bit more in the glenohumeral joint, it might not hurt as much. That in itself is also a very, very sensory mediated experience. So now if you can move better from this sensory experience, we then got to call that a sensory motor experience. And that's really what I think manual therapy is. It's this often, not all the time, positive or ideal sensory motor experience. And it's not even, I don't even know if it's possible to explain every possible pathway that the different types of manual therapy, whether you're creating, and let's say it's only your hands, forget about devices or even needles, what you can create: deep touch, light touch, vibration, deep pressure, all of these different models. You can pull the skin away, and maybe that's affecting Merkel cells. Maybe that's how tape works. All of these different things have all different channels. It's like this totally complex choose your own adventure. Go to page 17 if you want to go left. Go to page 34 if you want to go right. And then once you're at 34, you got no more other decisions on what you want to do when you get to the dead end in this castle. So I'm not even sure it's even possible. I think you can talk about a specific situation and be like, okay, this is what I think happened. Well, this is what I think happened. At the end of the day, if the person's shoulder moves in a more desirable fashion, which then allows them to throw heavy weight over their head, which was their desired goal and why they sought therapy or manual therapy or massage or whatever, then you win. Like, I'm not saying it doesn't matter at all, because I do think it's frustrating, as I think many others are frustrated and express it probably in a different way than I am, that, well, you were breaking an adhesion, or your joint was out of place, or C5 was out of place, and all of these things that I probably don't believe. I do believe those are possible entry points of which to apply a sensory motor experience. And given the realities of dermatomes and myotomes and sclerotomes, you can rationalize what you did to then create this other result. And then we're all off to the races. We all get to the starting line at that point. And if we get to the starting line in different ways, I don't think that's inherently bad. I feel like I should be able to drop off a patient at your facility, and I'm going to say, I need more hip internal rotation, and I'll be back in 2 weeks. I don't care how you did it. I do know that if you only do some, rudimentary therapy in the area that you think is limiting internal rotation, I'm not sure that's going to last. I think sometimes it can, but I'm not sure you did anything that couldn't have been done with something else. That being said, if you then apply other types of strategies of tension, then it'll probably stick. That would be what I would think. But if I show up there and you go from 30 to 45 degrees of hip internal rotation, you did it. And no one should think that somehow that didn't happen. It may not have happened for why you thought, because at the end of the day, you can only prove two things. You can prove what you thought you did. I think a lot of times you can be wrong. I can be wrong. You can be wrong. We can all be wrong. But you can say what you think you did, or you can say what you were taught to do, and what you're trying to accomplish when you do a grade 3 Maitland mobilization, where you take it up to the end range and then you jostle or oscillate around the end range, if that's even a grade 3. You can say that's what you thought you were doing. And that was how you communicated with what the individual's wrist felt, and what your hands felt, and then what you told your brain and how you had to adjust what you were doing with your hands. All of that you can justify from your narrative that may not be what was happening. What you can categorically, from a third party, objectively measure: does the wrist hurt less? Does the hurt wrist at all? And can you now move to 90 degrees, and then can you bang out a whole bunch of push-ups? Those things can always be proven. And how we got there probably, again, isn't always the reason why we got there, but you still got there. That's where manual therapy has its role. I hope no one's hearing me say it doesn't matter what you actually did. I think there's a sensory motor experience that has far more to do with oxytocin, serotonin, and dopamine more than anything mechanical. But you still needed this mechanotransduction, this physical process that got translated into an electrical process, and then the perception of that process, which could only be referenced by previous experiences in the brain. Then and only then is there some type of logical, scientific merit to what we're actually doing, whether it's a high velocity, low amplitude thrust, a very, very deep and compressive pin and stretch, heavy elbow over a particular area. All of those things, can all be justified through what I'm suggesting of this sensory motor experience. Now, it's kind of when you know the rules, you break the rules. Yeah, there's going to be some areas that have a more profound impact. What is truly, genuinely impacting that process? I'm not sure we know that. I don't know that there is evidence as to why that trigger point typically does X, or why that center of fusion typically does X, why even C5 affects this particular area, other than it does. And I think embryology has a lot to do with that. I think the answers probably live there somewhere in that process, but it doesn't change what's genuinely happening when you apply some type of mechanical process through therapy, needles, vibration, scraping, all these different things indeed have a very different physiological process that's happening, except I think how that physiology drives the brain is probably far more defensible than any of the specific or purported physiology. So manual therapy absolutely works. It just might not work for why you think it does. That doesn't mean you shouldn't do it, and it doesn't mean you should even change your mind. Just don't get mad when somebody says it's not what's happening. There's no such thing as adhesions, except I think what you think you're doing when you break up an adhesion, as long as my shoulder moves better, I'm happy, and you should be happy too.